This is going to be an instructional video on how to do 4 and 12 lead EKGs. We will do these steps, and the student will be able to recognize and place the electrodes in the appropriate place. Also, we'll be able to know how to run a cardiac monitor. In this case, it is a physio control 5-pack 12. Realize not all monitors are the same, but most of them do ask the same questions. The questions that it'll ask is the age of the patient. That's the most important thing to put in at the time of doing your 12 lead. But we will start out basically with the 4 lead and then advance to the 12 lead EKG. First of all, the patient's probably complaining of chest pain or some cardiac origin problem. And we'll already have a complete set of vitals. First, to turn on the machine, let's hit the power button. So we have this screen. And then we will apply the 4 leads at first. And there's an acronym to remember that: white right, smoke over fire, and then green as a ground, which would also go on the right side. So we'll attach the leads to the electrodes first. It's easier to do it that way. That way you're not trying to push against your patient's body. Put your arms down. Push against your patient's body while applying these leads. There you go. And like I said, white right, the black one, which we call smoke, will go over the red one, which will go right below it, smoke over fire. And the green for ground, which is on the other side. This video is intended for EMTs, advanced EMTs, paramedics, hospital techs, and
push analyze,
and nursing staff, physicians if they wish to take it. And here we have a picture of a 4 lead EKG, and we need the patient to lay very still during this process. If we decide at this point that our patient needs a 12 lead, you may have to open up more than one set of electrodes to get this done. This is Rod Riley, our patient, and he's been nice enough to volunteer for this video. So we go in order. They are labeled 1 through 6. We'll start out with number 1, and we'll go the 3rd to 4th intercostal down, going down the sternum each side, which is about right here, and you can feel them as you count them. You get to 3rd or 4th, either one, and you place number 1 on the right side of the sternum at the 3rd or 4th intercostal. Lead 2 goes straight across from that. Lead 4, I always go first with lead 4, and that's straight below the nipple line. Lead 6, I do next, and that goes up underneath the armpit. Leads 3 and 4, or I'm sorry, leads 3 and 5. The fifth one goes between 4 and 6, and lead 3 goes between 2 and 3, as such. Then we attach the rest of the leads to the monitor like so. Okay, over here on the monitor, we then will go to a 12 lead cycle, so we'll or the 12 lead mode. We'll push 12 lead. Right here is where it asks for the patient's age. What's your age? 52. Mm-hmm. So you dial this up to 52, and hit the center button to check for that. Then you hit, and right now it is acquiring the 12 lead EKG. Noisy 12 lead to accept. Okay. If that happens, just press down on your leads to make sure they're secure. And we'll do it again. And it should run us out a sheet. It's analyzing the 12 lead now. And right here is our 12 lead. Further in the class, on the next session, we will learn how to interpret these leads. Thank you very much.